Violence against women is a major problem in the world today. 1 in 3 women experience physical or sexual violence. A study conducted in New Delhi in 2012 stated that 92% of women reported sexual violence in public spaces, and 88% have experienced verbal sexual harassment. Around 120 million girls worldwide, that is slightly more than 1 in 10, have experienced forced intercourse or other forced sexual acts at some point in their lives. Despite the fact that 119 countries have laws on domestic violence, 125 have laws on sexual harassment, and 52 have laws on marital rape, violence against women still occurs regularly.
There are different types of violence women may experience, one being domestic violence. On a typical day, more than 20,000 phone calls are made to domestic violence hotline nationwide. 19% of domestic violence involves a weapon. Women between the ages of 18 through 24 are most commonly abused by an intimate partner. Another form of violence against women may be human trafficking, which is when a person is bred or tricked into working into terrible conditions, i.e., kidnapping.
Pregnant women with disabilities experience more violence than those without. Disability is a significant violence predictor. The number and types of stress sources significantly affect the likelihood of violence. Poor health behaviors also contribute to the likelihood of violence. If you are being abused by someone you rely on to take care of you, you may feel trapped. Women with disabilities are 3 times more likely to be raped, physically abused, or sexually abused. Violence against them is often ignored in several countries.
There are many ways to prevent violence against women or to help women who are victims of violence. First, you can start out by calling the police. If you're in immediate danger, dial 911. You can call different hotlines. Hotlines provide support and resources. They can also help create a safe place if you need to leave an abuser. You can reach out to people you trust, such as family, friends, or any community organizations. You can talk to a healthcare profession such as doctors, nurses, and counselors. Doctors and nurses offer physical aid, and counselors offer more of emotional support and resources. You can contact a shelter or rape crisis center. The shelters can help provide food and housings and other types of help to victims of violence. You can find shelters and services by contacting a hotline or through state resources. You can contact an advocate. An advocate is someone who is trained to help people who have lived through domestic violence, dating violence, or sexual assault. Advocates are available over the phone or in person. It's confidential and it's free. Lastly, there's a Green Dot program, which is a program that trains people about sexual assault and domestic violence on college campuses, primarily on primary and secondary schools and communities. Really, it's a bystander intervention program, and those are a few different ways that you can help either prevent violence against women or help those who have already been victims of violence.